Okay, hello everyone. Welcome to It's a Brain Thing. Again, I'm Dr. David Henley, and a few introductory remarks. This is the monthly conference we have about the brain, and this month I've decided to talk about bipolar disorder, partly because everybody had wanted to hear about this, and we had to unfortunately cancel the November 15th date because of the tornado warnings in the area, but this is our makeup date. And again, this is going to be played on WSC-TV, which is Channel 21 out of Richmond, every Monday night starting at 8 p.m., every 4 hours then until Tuesday at 4 p.m. So if you know people that want to see it and didn't get a chance to come tonight, just tell them about that if they live in the Richmond area. So sometimes we talk about disorders in here, and I think it's difficult for folks to kind of visualize or picture these things if they don't know anybody that's been afflicted with the illness or is affected by it in some way. Tonight I was going to try to present some sort of real-world information to you. I'm going to kind of use a famous artist that many of you will recognize. I'll show a picture here in a second, and see if. And actually, I have some excerpts from some things that have been written about him, and also a letter that he wrote to his brother, and it gives you just a glimpse inside his mind, and while he was suffering from bipolar disorder. Some of the things I'm going to say, basically it's known fact that he had bipolar disorder, but some of the paintings and things that he made, I sort of have kind of deduced on my own that I think his mood may have been a certain way or the other, based on the type of painting that it is. So first of all, let me show the picture and see if anybody recognizes this gentleman. I just showed this a minute ago before the camera started, so everybody probably already knows. But can anybody say who this is? Vincent Van Gogh, excellent. This is a self-portrait, and I'm sure from art class in high school everybody remembers that he had some mental illness, and it turns out it was bipolar disorder. And at this picture here, his ear is bandaged because he cut his ear off and sent it to his girlfriend. But what I want to discuss tonight, and I know that's kind of gruesome, everybody's kind of, but what I want to discuss tonight is bipolar disorder, and Mr. Van Gogh did suffer from this. Bipolar disorder, I guess the first thing I should start out with is, I usually start out with how common something is. Why do we care about it? Because it affects a lot of people. Classic bipolar disorder, which we call type 1 bipolar disorder, is about 1% of the United States adults. Okay? If you look at all the different types of bipolar disorder, and we'll talk about a few of those in a few minutes, it's about 2 to 5% of U.S. adults. So it's not insignificant, the amount of people that are affected by this disorder. First of all, let's go right into what is bipolar disorder. I mean, what is it? I guess the key thing, or the easy way to think of it is pretty vicious mood swings. It is a mood disorder. We call it a mood disorder because it affects people's moods. As you know, all of us have moods, so from any moment to the next we might have a fairly decent mood, we might be happy, sad, angry, these different things, right? And that is a normal change. I mean, for most people there's a certain limit with which their moods, I guess a range with which their moods lie within. So up here is somebody who does not have a mood disorder, okay? Maybe they're going along and their mood is fairly stable, and then they have a pretty good time. Maybe they get a raise at work or something good happens in their life, and they have a fairly good mood for a little while. Then they come back to normal again, and then maybe something bad happens and their mood sinks. Incidentally, it doesn't always have to be the case that something bad or good happens for your mood to change. It could be that, but it doesn't have to be. And then sometimes, like we'll see, sometimes with bipolar disorder, it'll just swing on its own without any stressor. Certainly stressors or things in your life could cause it, could trigger it, but they don't have to. So folks with bipolar disorder, and I wrote up here type 1 and type 2, those are the two main types. Folks with bipolar disorder type 1 have mood swings where they go very high, we call that mania, and then very low, where we call that depression. And we talked about depression last 2 times ago, and I'll discuss all the symptoms of that in a second. But you see where there's some times where their mood is fairly normal, but then they can go all the way up and become manic, and we'll talk about what that is in a minute. And then they'll bounce around a little bit sometimes, get depressed, and then kind of eventually come back to the normal mood. And there could be a normal mood for, or this type of mood, basically. They can have that for, 18 months, 2 years sometimes, even longer. And, so it's pretty tricky. It's not like they're always manic or always depressed, Type 2, on the other hand, the real difference here is they still have major depression. They still have these depression moods that are the same, okay? Same as a type 1, but they don't go fully manic. They don't go into the full mania. They get into what's called hypomania. And this is what I put on our little flyer. This is where everybody would love to be. And I'll explain why that is in a few minutes. But that's a state that feels pretty good. And it usually doesn't interfere with function, so it's not so bad. The problem is, the disadvantage is that you can't really stay in this state for very long. Sometimes, of course, the risk of being in this state is then you crash and you get depressed. Or if you're type 1 and you get hypomanic, it could be a sign that you're ready, that you're going to continue to keep going until you get into mania. So let's talk about, first of all, let's focus on each one of these different types of moods, okay? Let's talk about the depression first. We talked about that 2 months ago, I think. And it's really the same. The symptoms can be very much the same as somebody who has plain major depression. What that would basically look like is somebody whose mood looked like this. They don't have the hypomania. They just have the depressions. And they sink into these depressions, and then they come back into a more normal mood. So major depression is the same, except it doesn't have these high moods. And the symptoms are, if you remember, it's at least 2 weeks of a very down or very irritable mood. This is more than just a blue mood. This is a pretty, hopeless, really feeling very down the dumps kind of mood. And it lasts almost every day for 2 weeks, okay? And it interferes with your function. Okay, if it's not interfering with your function, it may not be full-blown major depression or a depressed episode like this, okay? In addition to the mood being down, you have to have other symptoms, okay? And we talked about that before, and this will probably prompt your memory a little bit, but changes in energy level, okay? That can be either a higher energy level or a lower energy level, but some change from your baseline energy. Changes in sleep patterns, same thing, either high or low, but different than what it was before. Changes in appetite, again, same thing, either higher or lower than your usual. A lot of folks that get depressed have guilt or worthless feelings. They're always kicking themselves about things that they shouldn't have done, or they should have done this, or there's a lot of that. Lack of interest in most things. Totally lose interest in things they used to enjoy doing. Hobbies and things like that. It can be things like that, but it also can be things like they used to like to eat, and now they just don't have any appetite anymore. Good food doesn't even look good anymore. Sex drive drops way off. Concentration and memory are affected when somebody's very depressed. And then again, the biggest risk factor, or the biggest thing that concerns us is besides the interference with function, is that sometimes folks get to feeling very hopeless. There's no light at the end of the tunnel. So they start to have thoughts that maybe I just wouldn't care if I woke up or not. And those thoughts sometimes transition into get worse if you don't treat it, and they go into thoughts like, I think I should just put myself out of my misery and take my own life so that nobody else or myself has to suffer anymore. That's the danger of suicide, okay, if untreated. These episodes, they last at least 2 weeks, but typically they last longer than that. And it's not like somebody has this. I didn't draw this maybe quite right, but it's not like somebody goes along and has a fairly normal mood and then bang, one day wakes up and they're severely clinically depressed. It's a slow, gradual thing. It's slow to go into it, and it's slow to come out of it. Even with treatment, it's slow to come out of it. Okay. The interesting thing about it is, and the more folks that I would see with depression, the clearer this came to me is just how much depression influences how you think and how you view the world. Everything, when you're depressed, everything looks terrible. You can't do any good. There's no light at the end of the tunnel, like I said. Everything's skewed. Everything just looks very bad, pessimistic, and that's hard to explain, I guess, unless you've seen somebody that's had depression. But they may have the world to live for, but in their mind, they can't see it. They just don't see it. And it's not a character flaw or some weakness in them that doesn't allow them to see it. It's actually their mood that's affecting the brain and causing them not to be able to see it. Incidentally, most people with depression realize they're getting depressed, or they feel once they get there anyway, they know that